So, surprisingly, about 11 million people voluntarily inject lethal bacterial into their face to reduce the signs of aging. This is known as botulism toxin A, better known to us as Botox. It is currently the most common cosmetic procedure performed in the world today, so I will be informing you about the surprising origin of Botox, its various usage, and things to consider before receiving any Botox treatment. So what some of you may not realize is that Botox is a small dose of a disease-causing bacteria known as botulism toxin A. It is a lethal, naturally occurring bacteria that grows in the absence of oxygen and is commonly found in soil. It was discovered in 1896, and after its first outbreak, it resulted in many sick and many dead. So it affects patients by blocking the nerve signals to the muscle, which results in them to stop contracting, which then leads to paralysis. Since its outbreak, it has been reported that there's an average of 110 cases per year. So, supportive care and hospitalization is needed for recovery, and if it is not treated, it could lead to paralysis and/or death. According to the Clinical Journal of Pain, the first therapeutic medical use was used to treat cross-eyedness and uncontrollable blinking. It was not yet approved until 2002 by the FDA for cosmetic procedures, although it was used therapeutically for things such as muscle disorders, conditions of the head and neck, excessive sweating, severe migraines, and muscle spasms associated with strokes and Parkinson's disease. Botox is the most common on the market in the cosmetic field, and according to the company Allergan, cosmetic Botox is a treatment when a patient receives an injection with a fine-tip needle into the desired area of face. Patients typically seek this treatment to reduce the wrinkles and frown lines due to aging, and the dosage of botulism toxin is released into the muscles to temporarily paralyze for the time span of 4 to 6 months. So, just like any other medical procedure, there are obviously some signs and symptoms of receiving Botox. Some side effects that are typically non-harmful and temporary, but they do include dry mouth, headache, pain, bruising, an infection around the area, and possibly an allergic reaction. It is important that a patient ensures that they're receiving the treatment from a certified and very trustworthy doctor, because there has been many forgeries of fake Botox distribution that led to death because they wanted to receive it in a cheaper fashion. Botox injections have been widely acclaimed for their short-term and anti-aging properties. The procedure was gained popularity as it is non-invasive, leaves absolutely no scars, and the recovery period is low. However, it should be recommended that Botox can be an addiction, so it's an inducing substance and its patrons may become heavily dependent on the drug to look young and feel good. So next time you think about possibly getting Botox when you're older, you just might want to think about the side effects and what it may or may cause, even though you would feel good. Thank you.